Welcome and thanks for pressing play. This episode of WarDocs was made possible by a partnership with the Defense Strategies Institute's OpMed TV and was recorded at the 2024 Operational Medicine Symposium in San Antonio. These interviews focus on optimizing military medicine through the modernization and implementation of policies, education, training, research, and development. We also explore emerging technologies to enhance the health, strength, and survivability of warfighters. Welcome to the special episode of WarDocs in partnership with OpMed TV. I'm your host, Dr. Doug Soderdahl, retired Army urologist, and I'm joined today by Chief Master Sergeant in the Air Force, Thomas Wigington. He is the Senior Enlisted Advisor for the Joint Staff Surgeon Office. So thanks for being with us today.
Thank you, sir.
So as the Senior Enlisted Advisor, how do you advise the Joint Staff Surgeon and the Joint Chiefs?
It's a brand new job. We just created it. So I've been in the seat for about 80 days now. And they really didn't know what the job was going to be. And so since I'm the test case, I'm really making it to what it should be. And so what I really try to do is just try to advise the surgeon on all things enlisted. And so, I've been at several levels of leadership and strategy, from being in a MAGCOM medical chief to being a career field manager right before I got this job. And so what I've always seen is that the enlisted presence sometimes isn't there, or that enlisted voice isn't there. And so what I try to do now is just make sure that the enlisted perspective is given. And then also for the chairman of the Joint Chief of Staff, I work with his Senior Enlisted Advisor, SEAC Black, in regards to helping give that medical perspective to our Senior Enlisted Line Leader on what some of the medical challenges are across the entire joint service.
Part of your job I listened to you this morning, and you said that you like to be able to explain the message.
Yes.
And so from the joint surgeon, what is the message that he wants the military medical community and the military community to hear right now?
Yes, sir. So one of the biggest pushes, and you kind of saw it on the Pentagon slide, as we call it, where we talk about that we are a military health system. I feel that there's been a lot of challenges that have come up over the past couple of years with the establishment of the Defense Health Agency. And so there's been some identity finding and everybody trying to figure out exactly where they fit into the system. And so really what I've seen that General Andrews has done with that Pentagon slide is really define that we are a military health system that consists of Defense Health Agency, the services, and then the chairman of Joint Chief of Staff and the Joint Staff Surgeon, and that the system is complete when all of us are working together in team in unison, and you can't have one without the other. And so I feel that's the biggest take-home message now, is that we are a military health system, and the only way for us to effectively be able to support our nation is to work as a team. But also working with our whole of nation approach with our civilian medics to ensure that we're taking care of our personnel for whatever that future fight is going to be.
One of the things that I thought was interesting what you said, because going back in my career, we've always talked about this purple suit military for military medicine. And you said you didn't like that term because what we really need to be is joint and interoperable, where it doesn't matter what uniform you're wearing. And it's important to keep wearing your service uniform, but be able to do the same kind of things and work together. Can you expand on that a little bit?
As I kind of alluded to, before I got into the seat in the Joint Staff Surgeon, I used to be like, we need to be purple. Medics need to be purple. And then the more I thought about it, I deployed in 19, and so we had to call for the Army to come out and support us with some air sampling. And one of the challenges that we faced is that they didn't have the people to send, so they sent us the piece of equipment. The piece of equipment comes, and we're like, we have nobody who knows how to use it.
Right.
So I had to send somebody back to the States to get trained for 2 weeks. Then he came back and he used the equipment. Rewinded back, my wife, she deployed in 2016. And she went and filled a Navy tasking. She gets there and they're like, well, do you know how to do soil sampling and air sampling and everything? She's like, no. They sent her to Spain for 2 weeks to get trained on how to do it, and then she came back. And so the more I thought about it, I said, well, we don't need to be purple, we just need to be joint. And in being joint, there are going to be service unique mission sets based off of what our focus is. And with that, how do we plug and play? How do we standardize the training, the equipment packages where we can? Not saying it will always be able to happen, but we should be able to standardize as much as possible. And so when I say that we aren't purple anymore, we just have to be joint, that's really what I'm trying to allude to.
So another thing you mentioned was that seemingly we're at an inflection point in history. And I think, going from our last major intervention, OIF, OEF, to what's coming in the future, we're seeing that things may be completely different. Mm-hmm. It may not be exactly what we experienced in Iraq and Afghanistan.
Yes.
And we need to train enlisted medics and corpsmen to have capabilities that maybe they didn't need back in those days. What are we doing to address that for the time where there's prolonged field care scenarios, can't get people out, there's logistics problems? How do we prepare our medics and corpsmen for that?
Yeah, so with that, the services have adapted the model of TCCC. I feel that is a useful program, and the fact that it has the various tiers. Something I was trying to push, but before I got this job is that we have to really be thinking about which teams are going out and where they're going to, and based on where they're going to be embedded at, how far forward they'll be. They probably need more advanced training, and because they may be the only, they will be the only medical contingent that's there. And so we have to ensure that they're trained to a higher standard of proficiency to be able to support that workload that they will potentially see. And so that really just comes down to the services having a joint understanding of what's going to be required in the future. Part of what my job is to really try to think outside the box and think about those things, and then have those talks with our senior enlisted leaders for the medical side and all the services in Defense Health Agency in regards to how do we synchronize and modernize and standardize our training practices and principles going forward.
When you're in the meetings and General Brown is asking his surgeon, saying, hey, lots of stuff's going on in the world. We've got a medical team, a medical health system that's supposed to take care of it. Are we ready? How does General Andrus answer that question? And if he says, yes, we're ready as best we can, how do we know?
I think that's always a challenge. If you ask me personally, just TJ speaking, we'll never know if we're ready. It's almost like what Tyson said, everybody thinks they're ready until they get punched in the mouth.
Right.
And so
everyone's got a plan.
Yeah, everybody, you have a plan. You're like, okay, this is what I'm gonna do, and then it happens. I can tell you that I feel that just based off of what our training is now, from a joint service perspective, will our medics be able to get in there and execute? Yes, they will. Are there going to be challenges? Are there going to be some growing pains? There definitely will be. But I have full confidence that we will be able to adapt going forward, and that would be the message that General Andrus would give to General Brown. And then with that, we'll have to continue to identify ways that we can work better together, identify what those joint requirements are, what combatant command requirements are, to ensure that everything is synchronized, and then also try to get after it from the perspective of a whole of nation while pulling in our Guard and Reserve partners as well to ensure that our warfighters are squared away.
Yeah, talk about that. You mentioned that we have to keep in mind that it's a total force effort. How do we make sure that we involve our Compo 2, Compo 3 brethren in medicine, military medicine, in the training opportunities and synchronize with what's going on?
From our level, part of that it's really occurring now. In all of our meetings, we bring in General Ferris and her team. We bring in the Marines. We're going to start bringing in the Space Force Surgeon General as well. And I think that helps us really get a defined thought process of how we need to be moving forward. It's been good to have General Ferris in the room because as she talked about during the panel, she does bring up those challenges that we aren't thinking about from a active component perspective, but also listening to her was part of the reason why we were sitting in a meeting a couple of months ago, and I was like, well, if we pull all the reserve components out and send them down range, who's going to be here to take care of those patients when they come back? And everybody in the room was like, that's a good question. But it was sparked off of a conversation that General Ferris was having. That I was listening to what she was saying and trying to figure out, okay, what are the challenges that exist? What are the things that people are saying, but they're not saying that we may be missing because we're not listening to understand, we're listening to respond. And so that's kind of the perspective that, I try to bring to the table, but also I know that General Andrews does the same thing. Working with him the past couple of months has challenged me to think outside the box because the way that he approached it, we are really taking a lot from what General Brown says and thinks, and he thinks outside the box as well. And so, it's unique, it's challenging, but I think we should be able to answer it appropriately and ensure that we get the medics where they need to be.
So your career, you have a lot of experience in preventive medicine and public health. What would you say are the major challenges and concerns in operational medicine in that Prev Med and public health space?
Prev Med is always one, it's one of those professions that I tell folks it's not sexy. Healthcare is about getting those patients in. The system is built on getting patients in and that patient count. Prev Med is to keep patients out of the clinic.
Right.
So it's really counterintuitive. Prev Med gets a lot of focus when things like COVID occurs. But then after COVID dies down, it's like, okay, Prev Med folks, we appreciate you, strong work. Now it's time to get back to the sniffles and everything else. And so I think one of the biggest challenges is just having a mindset shift from what is that future fight going to be. I say that General Friedrichs, he summed it up the best. And he said, the future fight with our near-peer competitors is going to be primary care and preventive medicine. With that, how do we ensure that we can keep the warfighter in that fight? It's Prev Med. But we have to start thinking more of proactive medicine instead of reactionary medicine. Yes, we're still going to have a need for surgeons and all that. Those type of injuries and wounds are going to occur. But we should be focused on how do we keep the warfighter in the fight as long as possible without them going down from being exposed to a disease, bacteria, some bad food or water, and so that's where I feel that Prev Med mission is going to be critical in the future.
So not sexy, but super important.
Yes, sir.
All right. So I want to just ask kind of your personal journey question. How did you initially get connected with Air Force medicine?
I grew up Army. Planned on going to college to play ball, and then, figured out that wouldn't work because I wasn't playing sports in high school like I needed to. And then, I reached out to my father and was like, hey, look, I want to go to college. We looked at some things and then he was like, well, I don't have the money. I'm Army. And so originally I had enlisted in the Air Force and I came in and I was supposed to come in and be as they call them, a dirt boy, climbing poles and digging ditches and laying wire and everything. Things just happened. Life happened. I was a knucklehead, stayed in trouble a lot. And so my father was like, hey, look, one way for you to not stay out of trouble is just go into service early. So I came in open general. I didn't find out my job until 2 days before I graduated from basic. And at that point, I didn't know what it was. My TI, all he told me was he was going to be a PP checker. And I said, oh, what's that? And then he told me again, and I was like, okay, I don't understand what that is. And then I finally went off to tech school, and it's been a fun ride. I say that we're medics, but we're not medics. A lot of my job is dealing with the base, doing a lot of briefings. And so that's the piece that I really love, is actually being able to get outside of the hospital or the clinic and actually interact with the base, really get to see what the challenges are that some of the career fields face in executing their mission from an occupational health perspective. I do food inspections, sanitation inspections. We count mosquitoes, identify them. That's the piece I love. I just ride off and be gone all day, trapping mosquitoes and ticks and everything else. So that's the reason why I've stayed doing this for coming up on 27 years.
What would you say has kept you in uniform? What is your driving why? You wake up in the morning and say, I'm a Chief Master Sergeant in the Air Force. This is why I do what I do.
Originally, it was my kids. It's like I'm gonna stay in as long as I can until my youngest graduates. Well, he graduated about a year ago. Now it's just, it's still fun. It's still fun, and I've been in positions where I get to help people. And so my viewpoint and my vision is, and my motto is, even as a career field manager for public health, I would get on the calls and tell them, I work for you. My job is not to be anybody's daddy. I tell them I have 7 kids. I don't want any more. I'm a big brother. My job is to make sure that you're trained, that you're equipped, you're competent, you're capable, you can get after your mission set. And I think that's why I've stayed around, and I'll probably stay around till I get to 3 more years, because of the fact that I get to work for people, not lead them. I let them lead me. In the position that I'm at is for me to really get in there and clear up all the barriers and bureaucracy that exists. That's what my job as a chief is, and so that's what my drive is now, and the passion.
So we have some younger folks that listen to the podcast, maybe in high school, early college, that are maybe considering a career in military medicine, anywhere on that team, medic, corpsman, nurse, doctor, PA, whatever. What kind of advice would you give them if they asked you, hey, what should I do about this idea of being part of the military medicine team?
And so I will say it's fun, it's a journey. Is it hard? Yes, it definitely is hard. Anything in life that's worth it is going to take some work from you. You do have to adapt to this culture. The military is a way of life. It's a significant way of life. It's important. We are part of that 1% of the nation that says, I will give my life in defense of my country. And that's a significant statement. But the rewards that comes from it, can't be beat. If you want to come into the military to get away from, where you're at, just get something different. Come in and do 4 years, 3 years, however long you want to do. Get that experience. Get away from your hometown. Grow. You get to travel in the military. And I tell folks, I travel for free. And so even just growing up in the military, I lived in Germany for 8 or 9 years. And those were some of the best times of my life as a child growing up. But then, just in my active service, I've been stationed a little bit of everywhere, and been able to experience different cultures, and it's given me a different perspective. On top of that, they pay for school. You can't beat that. Right. You work for an employer that's going to pay 100% of your school. All you got to do is go to class, show up, and pass. So I've gotten a couple of degrees free, compared to if I went to college, I'd have had the student loans, which I would have taken. But it's definitely been fun to get paid to go to school, and so it's not a bad life. It is challenging. It does get hard at times. The deployment can be challenging and difficult. But what I found is that it's a family, and that's how I always approach this, as it's a family. I have brothers and sisters in arms, and anytime I've needed anything, there's always been somebody who's been there that would look at me and say, TJ or Wig, get your life in order. Or, you know what, brother, I'm here for you. And that's what I would say. If that's what you're looking for, come on over. And we definitely are always trying to find new brothers and sisters to bring into the family.
We've been speaking with Chief Master Sergeant Thomas Wigington on WarDocs podcast in collaboration with OpMed TV. Chief, thanks again for your time, and thanks for sharing your insights. And it's nice to be part of the family.
Thank you, sir. Thank you.
Thank you for tuning in to this special episode of WarDocs, made possible by a partnership with the Defense Strategies Institute's OpMed TV. To stay connected with Team WarDocs, visit our website at wardocspodcast.com. Follow us on social media for updates and subscribe to our WarDocs YouTube channel for more engaging content. Your support helps us continue to document the experiences and contributions of military medicine professionals as we honor the legacy and preserve the history of military medicine for the next generation.